Hi, YFP community. Corey Sanders here, host of the Pharmacy Innovators segment of the YFP podcast. Pharmacy Innovators is designed for pharmacists navigating the entrepreneurial journey. In this series, we feature founder stories and strategies that help guide current aspiring pharmacy entrepreneurs. Today, we feature Dr. Jena Quinn, a board-certified pediatric pharmacist that established Perfecting Peds, a consulting business focused on medication management in complex pediatric patients. In just 18 short months, Jena has expanded her business across multiple healthcare systems and hired support staff that is pioneering pharmacy consulting in the state of New Jersey. We discuss how she financially navigated her transition, the unique timing of establishing her business, and plans for the future of Perfecting Peds. I cannot wait for you all to learn from Dr. Jena Quinn. All right, so Jena, we will start things off with a really easy question. For those that don't know you, tell us a little bit about where you went to pharmacy school and how you got into the profession.
Yes, so I went to pharmacy school at Rutgers University, New Jersey. Even at 34, I'm like the biggest baby, and I won't go like more than an hour from my parents. So hence why I landed there. And it was between that and University of the Sciences in Philly. And my parents said, you're going with the cheaper school. So that was pretty much how I made that decision. But as far as the profession, my grandfather, who has been my lifelong mentor, he was a pharmacist for 60 some years. And the later parts of the last 30, he was the director at GlaxoSmithKline, where he patented over 150 drugs. So I always tease that he makes me look really stupid because he's just like such a wealth of knowledge. And he wrote many organic chemistry books, which was like my least favorite subject. But really, he is like my inspiration. And my mom, to be very honest, is a nurse. And she was like, nurses work too hard and don't get paid enough, so you're going to be a pharmacist, and that's what's going to happen. And so once I applied to pharmacy school and got in, and my dad called Rutgers to make sure that I really got in, that's where I went.
Just had to make sure.
Yeah, totally insulting, even all these years later.
That's amazing. So a little bit of family inspiration and then kind of just tying it all together with some of your interests, it sounds like.
Yes.
So how did you pivot specifically into pediatrics? Was that some kind of postgraduate training? Did you gauge interest with that on rotations? Where does that stem from?
Yeah, so historically, my little sister, she's 9 years younger than me, had epilepsy, knock on wood. It's been like 9 years, but growing up, I was always the one who took care of her. I'm sure nowadays it would be like a DCPP call, but like some sort of DIFUS call. But my parents, starting at the age of like 12, would just leave me with her, and she had epilepsy. And so I got really familiar with how to administer Diastat, what to do during a seizure and all the seizure precautions. And then I always knew I wanted to go into the medical field. And so I dedicated, which is funny because you know how life works out. A lot of my patient population is epilepsy. But I just knew at that moment that whatever I did in life, it would be taking care of these children at some capacity, whether it was a physician, a nurse, a pharmacist. And so she's really what drove me into the pediatric desire. And then throughout pharmacy school, actually, I just applied to do a couple of research as a student and research opportunities, and they were in peds. And then during my APPEs, again, I got partnered with majority peds. And then I actually am like one of those, I would say like older, I kind of got grandfathered in, but I only actually did 1 year of residency at a local hospital, Thomas Jefferson in Philadelphia, which I know traditionally a lot of pediatric pharmacists do too. At that time, I was like really done with the whole residency thing as far as it's draining. It was draining me. And so I, at mid-year, applied and got into Children's Hospital of Philadelphia, where I started their pediatric patient care program with a couple other of my colleagues. So like kind of like the in-between of a true clinical pharmacist and staff pharmacist, where we were on the floor rotating with the providers and then verifying orders. And that I did for 3 years, and then went to another local hospital and started the same program for another 8.
Wow. Well, you know what? It sounds like you had a lifetime of experience on top of the year of residency. So I'm sure that maybe the second year wasn't necessarily needed after starting with pediatric care at age 12.
Yes, that expedited it all. But it was, I was very much sure that life was trying to tell me something. And so and like I said, a lot of my patients in some way, shape, or form have epilepsy.
Mm-hmm. That's wonderful. That all ties together so well. And it seems like that was just the path that you were meant to be on from the start. So Jena, what I want to pivot to now is I think where we'll spend a majority of our conversation today is talking about establishing your company, Perfecting Peds, and what that ultimately looks like and some of the steps that you took when making that career transition. So why don't we start with what were the motives to leaving a traditional W-2 job? What were you striving for? What were you expecting when you started your own company?
Yeah, so motherhood changes everything. So I have 3 little girls, 6, 3, and 1. And when my youngest was 1 year old, I realized, and I worked the first full year of her life at the hospital. And I quickly realized that, because I started the program for pediatric patient care. I was like the first true clinical pharmacist there full time at Cooper. And what I quickly realized was that between 40 hours and then additional, I would have the residents unpaid. I would be called all the time for urgent situations that the medical residents needed help with in the PICU and the NICU. And I realized that my quality of life was really taking a hit, especially on my family time. And there was no separation at all. And so I quickly realized that I didn't want to be in the hospital full time, especially having a little one. So I went part-time, which then inevitably allowed them to hire a bunch of new people to the hospital. But for me, I was doing a job of a few pharmacists in one. And so that shed actually a lot of light on that. And they've hired a lot more people. But I was really desperate, to be quite honest, to kind of match my income and stay in the luxuries of the pharmacist salary. But I did not like the lifestyle that a full-time job left. And so what I did was I started in a multi-level marketing company selling skincare. And it was probably the best thing I've ever done, as silly as it sounds, but it actually was how all my mindset hacks, all my sales lessons, that they were all encompassed in. It was called Rodan and Fields, but I learned them all from my mentors there. So it was awesome. I had some great opportunities. I would travel to different countries on their dime, got actually the computer I'm working on. So they were very good to me. And what I realized was that I was really more obsessed with, 1, building something, and 2, just the flexibility of the job, even though I didn't have skincare is okay. I didn't have a passion for it, but what I had a passion for was entrepreneurism, setting my own hours. And really, I like the idea of having a team. I feel like, if anything, the people you surround yourself with is who you become. So I was like, you know what? And also at the time, so I did that for the entire time till my daughter, so for 3.5 years. And then I realized okay, well, what are you passionate about? Which was pharmacy. And so what I started realizing, even part-time, the lifestyle wasn't for me. I was missing things, for example, last week, I was able to go 2 things in the middle of the day to be at my daughter's school for just, one was a race and the other one was field day. And I was able to participate and be a volunteer. And I realized that I was working a majority of weekends and then a day or 2 during the week. And with the weekends, I started missing my daughter's soccer practices. And I was like, this is not happening. So again, so I started transparently. To be transparent, I started looking for other jobs. And in that process, I realized that there wasn't any jobs for pediatric pharmacists outside of the hospital. If they were the really niche like maybe a rare disease in medical science liaison, but it wasn't like there wasn't a robust amount of opportunities. And I felt like the only way I was going to leave the hospital is if I went into the geriatric or adult population, and that like literally killed me. So I love them. They're just, my heart's with children. And so, yeah, I was like, they smell bad. I can't do this. So I started looking for other jobs, and I actually got offered a job for a geriatric long-term care facility position. And that got my wheels spinning, because I was like, wait, we have long-term cares and like acute cares and all these medical days in the area. And I started looking around and asking questions to providers that work there. And I'm like, who's looking at these kids? These kids are like the sickest kids of the sickest. Their trach vent have multiple medications. And the answer was that nobody was looking at them clinically, was the politically correct answer. And so I went door to door, my salesman mentality, and was just like, hey, you're already paying a pharmacist. I'm sure you know this, like a lot of, if you're a consultant pharmacist too, like they're paying pharmacists to do this. And they're, I don't want to put down other pharmacists, but we have this unique training of residency. We're all board-certified pharmacists that are uniquely trained in peds, and it's very different than adults, right? So I couldn't, and geriatrics, I couldn't turn around and take care of an adult patient. I don't even know their disease state. So, I just said, whatever you're paying them, pay me and my team, and we'll take care of them, and we'll offer them, a bunch of unique services on top of the compliance work that they're already doing. So that's honestly how it started. I did kind of like the prep work and all the sales pitch over 6 months until I started getting some contracts, because I knew I couldn't take like that much a financial cut. And then once I started getting contracts, that's when I jumped full time into this.
Mm-hmm. Mm-hmm. And Jena, so many things that you said there that I want to highlight for the listeners that I think are really important. And the first one is that you weren't afraid to take a non-pharmacy related job because it wasn't worth sacrificing your mental health in the place that you were in. I think a lot of pharmacists can relate to the quality of life issues that you spoke of and the work-life balance, especially when you're in management positions. You really do start doing the work of multiple pharmacists many times. So I think so highly of you for taking that job and just being not afraid to say, I'm not going to do something pharmacy related right now. And that's how, confident you felt about yourself and how much you respected yourself. But two, it is great almost that you stepped into a sales job, because many people don't realize that sales is the lifeblood of business when you are first starting off. And if you can't sell your services, it completely hinders the product or the service that you can provide.
Yeah.
So probably an amazing stepping stone to be where you are today, and to have that mentality, like you said, to be able to sell what you want and be able to articulate that to other people.
Yeah. And I think too, like I got in such a habit, like social media is like such a powerful way to sell. And so when I was in Rodan and Fields, like no one's going to buy something from you if you're this is my opinion, if you're not authentic and people can't relate to you, right? So, or they don't know you. So like if I was going to actually make a decent income, it was building authentic relationships and just being like myself, so people could get to know me, so that then they'll feel comfortable buying from me. And it taught me so many life lessons. And part of that was just getting in the habit of posting on social media every day, irregardless of what it was. Like, it was just like whatever. I mean, I was always taught to kind of keep it in 3 categories. But for me, it was like always 3 things: family, and oddly enough, one was pharmacy. So I was already posting a lot of things about pharmacy organically. And then it was like a more natural stepping stone to start my own business. But as part of that, I just honestly switched from, because I'm focused more on B2B, I switched just to doing the same thing on LinkedIn to build my pharmacy presence, to build authentic connections, and to network. And so that's honestly how I've been able to meet amazing people like you. So like that has been the most powerful tool. And that was embedded in me from sales. And the other thing I do want to say is, like, pharmacists are the crappiest salesmen. And so because of that, our profession has taken a hit. So in order for we have to be good salesmen to show our worth and push and advocate for our profession to, go into a more innovative direction.
And that's such a beautiful statement that resonates with me a lot, because I work a lot with legislature and talking to senators and elected officials, and they truly don't realize what a pharmacist does outside of a dispensing role.
No.
And so, especially like you just said, as the profession evolves alongside technology, like it's going to drastically change in the next 10 years, we really have to learn to advocate for ourselves. And you're already just ahead of the curve by having your own business and being able to do that independently. It's a wonderful thing.
I think AI is going to be a soul crusher for like a lot of the dispensing roles. And so I didn't even know that AI was on the horizon when I started this. And my husband is IT and cybersecurity. So he's always in my head, but like, he's like, you better, whatever you're doing, you better not be able to be replaced by AI. And it's so true that, it is going to drastically affect our profession, but that's okay. I think it's going to put us in, like I just said, like before these long-term care pharmacies were doing compliance work, like checking out dates and counting narcotics, like that can all be automated. Like there's no reason for a pharmacist to do that. And what I quickly realized was I hired pharmacy techs. I'm like, pharmacy techs are amazing at this stuff. Like, why is a pharmacist with 8 years of education on top of maybe residency and all these board certs, why are we doing that? And the same goes with the dispensing role. Like, we are too smart and we went to school for too long to be doing that. And it really takes away from the end goal, which is, patient care. We want as much forward-facing time with the patient as possible to help the patient and advocate for them. And some of the traditional dispensing roles really take away from that. So I personally think it's an exciting time in pharmacy. And I think as far as if we leverage that and just use our education and sell ourselves accordingly, I think we're going to have a lot of exciting changes on the horizon.
I think so too. It'll force us to really utilize our clinical skill set across the board in a way that probably hasn't been forced before.
Yeah.
But Jena, I also want to touch on the fact that you said you just hired technicians, or that you've hired technicians. So let's talk about the growth of your team. How long were you just a solopreneur, really facing everything just by yourself? And when did you start to hire? What did that look like? And who was ultimately your first hire? I would love to know that as well.
I'm just laughing because it was such a cluster. So it's a true Jena fashion. So I started taking private patients, just like as like my beta patients, because I do think like, okay, I wanted to get used to the EHR. I wanted to also get PGX certified, like, this little like 20 CEs, but I also wanted to really take patients because there's not an abundance of pediatric literature in PGX. So I wanted to get comfortable in that because I do think, again, that's the way of the future. And we're going to have to utilize that to take the best care of our patients. So I started just taking like private pay patients. And that's how I got like started financially, but also just getting used to everything as far as like the EHR and training. And then I got 5 contracts all at once, and I didn't understand how medically complex these kids were until I opened the chart. So of 120 of the like roughly growing, I don't know, so what I'm doing some quick math in my head, like 300 of them had a minimum of 23 medications on their chart. And so I got all these dropped on me at the same time. And I was like, oh my God, like what did I sign up for? And so I quickly realized that I could not do this by myself. If I did, I would be, so to give you, again, I'm all about shedding light on things that should have their curtains unveiled. So the prior long-term care gave these pharmacists 15 hours for 120 critically ill pediatric patients, trach, vent, G-tube dependent. 15 hours a month at $200. So I couldn't even open and close the chart, plus do the compliance work, which is go through the med room and make sure, like, count the narcotics and all that. So I quickly outsourced that. That was honestly my first hire. Was I had a technician that I loved at the hospital that I worked with, and I said, hey, I need help. Are you looking for like PRN contractor hours? And so she jumped on board and she helped alleviate at least like I said, the doing all the compliance work. But then I realized that probably for the first year, me and my husband were going to be paying to take care of these kids. As like awful as that sounds, I think the pharmacy profession is so in need of advocacy and change. I knew that I needed my proof of concept before anybody even listened to me. And it was like, until I got the numbers of cost savings, cost avoidance, I knew they were going to be like, this is like a really cute idea, little girl. So I'm all like not even 5 foot. So I know people were not going to take me seriously. So my first 9 months of this business, which we just got all that exciting data in last month, was just like hiring pharmacists and, quite frankly, breaking even. It was just breaking even. And what we were providing was comprehensive medication management for all patients who had never had it before, providing pharmacogenomics, doing calls to parents who wanted to be a part of the care, and, and also giving some medication compliance software. And we have an app and MedRec that really shows the parents in 50 different languages called Med Action Plan, but where to draw up on the syringe, what exactly to expect from an ADR standpoint, when to call us. So all these services were provided out of pocket by me and my husband, but I just knew that it needed to be done, this proof of concept, because we've never have been outside of the hospital walls, with an exception of some rare like pediatric care clinics where the hospital was funding it, but there's never been a true pharmacist consultant role. And so I knew that, just like in sales, you need to, solidify your proof of concept. And it took me 9 months. And so now that we have the numbers, are in talks of some really exciting big contracts, but it took a really long time.
And it's beautiful that you were able to have the mindset and the wherewithal and the experience to be like, okay, I'm going to have to do proof of concept. And you were willing to just eat it for 9 months and then be able to put it together and ultimately set yourself up for something that's probably really great long-term, just knowing that you had to prove your worth, especially in this new, like you said, this is a new niche for pharmacists in New Jersey. Yeah. So realizing you'll have to put all that together. Yeah. So some of those, maybe the intricacies of the concepts or of the contracts, Jena, what did that look like? What did your first contract look like? Were you all set up to go for billing? Did you have to get collaborative practice agreements? Yeah. What did that first contract look like? And then where is it today?
Yeah. So again, like sometimes I don't even understand like what I'm doing until I do it. But it was like, I knew I was going to, whatever I was going to do, I was going to take good care of these kids. So when we first got the contracts, the collaborative practices weren't in place. But what I very quickly realized was that these physicians or providers, and just like anywhere, they are very, very stretched thin. And so we were given like an average of 10 to 15 recommendations per chart, and they did not have the bandwidth to go in and make those changes. And so that was pretty evident very quickly. And so I was like, this is not going to benefit anybody if we don't get a collaborative practice in place. So we have collaborative practices in place, which are a beautiful thing, and I think should be the standard of care for any pharmacist practicing, just because it just builds our autonomy and puts us on the same pedestal, or just like honestly the same like billing opportunities and capabilities as PAs and NPs who have done a beautiful job in establishing their worth. They're not doing anything automated with dispensing. So I really look at those two professions as like, how can we be like them? How can I be like an NP today or a PA? I don't want to diagnose, but how is there a way that I can use my medication knowledge to optimize patient care, be in front of the patient, be a part of their team? And so within 2 months, we got that up and rolling again. it is hard. Like I had to kind of scramble to find, okay, who's a good healthcare lawyer in the area so they can help read my contracts, because you don't want to do anything blind. So they've been an awesome addition to Perfecting Peds, an awesome and expensive addition, but necessary. And so what that looked like was like we would basically took over what they were doing, but instead we just did like a deep dive of comprehensive med management through a collaborative practice agreement and pharmacogenomics. As far as where our contract's at now, like I can't disclose too much, but we are starting to in talks with insurance companies, because in New Jersey, unfortunately, there is no opportunities to bill, even incident 2. So it is very disheartening. I know we were talking about you being in Hawaii and you feel like you traveled back in time. I worked at a hospital where I had so much autonomy, like too much autonomy. And then I came to outpatient land and I couldn't even change like a concentration of a med. And I was like, what's happening? Like, it was like, I just couldn't believe, I was just so dumbfounded. And so we were talking about advocacy and legislative, like I really admire what you're doing for the Board of Pharmacy in Hawaii and advocacy. And I think it's just so needed, because I'm not political, and so many people get mad at me when I say I've never even voted. But I realized real quick I was going to get political, because this is like how we're practicing is not okay. And so again, proof of concept, I knew if I had that, I could take it to insurance companies, I could take it to other facilities, I could take it to, home care companies, all these different places. It didn't have to be in New Jersey, right? Because I had that barrier of billing in New Jersey. But like, for example, in a couple of weeks, we're launching in Minnesota. We have some opportunities in Colorado. So you know what? It's not the best thing, but it's like, okay, well then I'll practice where I can practice until I give you guys enough literature, which we are publishing, to understand that this should be the standard of care.
It's amazing. So much of what you're saying really resonates with me, because it's amazing to realize that pharmacists are some of the only healthcare, or the only healthcare professional that's just taught to give away information for free.
Mm-hmm.
And that's not saying we shouldn't be answering questions when patients come to the counter and they're receiving a prescription, but ultimately any other profession is billing for the services that we are already providing. And so your proof of concept is just going to hopefully add so much knowledge and leaps and bounds of data of what can be done when we can practice at the top of our license. And I think that's going to be so meaningful.
Corey, like to your point, like I didn't realize, like, and this is not an exaggeration, weekly for the past 9, I guess people started catching when like I'm a pediatric and maternal health pharmacist, about like after I grew more confidence after CHOP. And then I was like I told you about posting. So then I would post like tips and tricks. And what I realized is that a minimum of 20 to 30 people were coming to me a week for their child or themselves. And I did it for like 9 years. And then I was like, damn, I think this is a business. Like, I'm like, and why has nobody else done this? And like legit just mad at pharmacists, at our profession, because I'm like you're saying, I'm like, every other person can bill. And like, I'm, coming with all this, like, we have this unique knowledge, and it's, I mean, daily, we make these life-changing interventions, and we don't get any compensation for it. And so, how is that okay? And long story short is it's not.
Exactly. And Jena, I want to circle back on something that you just brought up that we didn't get to touch on before, is your social media strategy. So something that I do love about following you is how authentic you are. And you said that that's always been your intention, is to just be authentic across all platforms.
Yeah.
What are you using primarily? Are you focused on LinkedIn? Do you use Twitter and Instagram? How do you kind of delineate between the different platforms, and where do you put a lot of your time?
I put most of my time in LinkedIn, just because like, I do think that as a profession, if we put a lot of our time there, we'll organically and over time educate the not only fellow pharmacists, but other fellow providers too. So, and there honestly is no strategy, similar to my life. But what I do is I try to do like 1 to 2 real patient cases, like things that I saw this week or I tried to do the week prior that, our team made a huge impact. Oh, and you did ask, we were 7 contractor pharmacists, 2 technicians, and an assistant.
Wow.
But I want to flip them. I'm starting to explore flipping people over to full time, which is an exciting change. But that being said, I have my team. We all, like, for the Perfecting Peds, we just like kind of revamped it so that we can streamline how we're visioning this. Is my goal is for Perfecting Peds to be anything from preconception, like I'm thinking about having a kid, what are the things I need to know, to adolescence. So we just started because I wanted to revamp and have it organized as far as the flow goes. But all of us on the team take tasks at different posts to do the Instagram Perfecting Peds, which flows onto our Facebook, and then the LinkedIn Perfecting Peds page. Now we're consistently posting there because it was like hard to do LinkedIn and all the other things. So I just focused on LinkedIn for the first year, which has provided so much opportunities. Networking opportunities have given me more than I've given them. But I tried to do at least 2 real cases to showcase, again, I'm a salesman, like, look, this is what pharmacists can do. And then I try to do like 3 hot topics or it could be anything, whether it's related to just entrepreneurism in general, things I've learned, tips and tricks. And again, a lot of them are authentic. Not all of them are like this positive rainbow. So I just try to like keep it real. Like, I have 3 kids. So not things get messy. That's for sure.
There's no way around that, I'm sure.
Yeah.
And Jena, I had said this to you prior to when we started recording the podcast, but something that I really admire about you is that the stage of life that you were in when you started your business. So you had already had 2 kids, your 3rd was on the way. Was that more of a motivator to step away from your job, or did that make things scary? What was your mindset going into the transition, being in that chapter of your life?
Yeah, so my first 2 were Clomid babies. So I was pretty sure I wasn't able to have children naturally. And so me and my husband had closed that chapter. I had bought my LLC, and 4 days later, I found out I was pregnant. And so I think like a normal person would have thought like, maybe this is my sign. God's saying don't do this. But then I thought, I think God's given me like 9 months to get this bad boy up and running. So I did. I used that. And I also leaned into it, that the fact that I can't do this alone. One of my past mentors, who quite frankly scared the hell out of me, at CHOPS NICU, reached out and said, like, I've been thinking about doing exactly what you're doing for 10 years of my life, and you're inspiring. Can I basically work for you? I'm like, yeah, like she's so much smarter than I ever am, and she teaches me so much. And so it was a humbling experience to see that. But I knew that it was going to force me not to be the bottleneck of the company in multiple ways, because I knew I needed to take, whether it was 6 weeks or whatever, maternity leave. And so, in order to do that, I needed to build up some systems and standard operating procedures so that I wasn't the only one that could do it. And so that was something that I knew from the start of it I had to implement, and had 9 months to implement. I did use it as fire. To be quite honest, my hospital gave me 6 weeks after the birth of my second daughter, and it really pissed me off. And I knew they were going to do the same shit again. And so I used that as, even though I loved everything about my job, the people, but it was just like HR. They were adamant that even though I'd only worked 960 hours, I needed 1,000 to get an additional 6 weeks. And so they were only going to give me that 6 weeks. And family time for me and my employees is non-negotiable. And so it really did not sit well with me. So I knew if I could build this up enough, that most likely I'd be able to leave right around then. And that's when it was.
And that's amazing. I actually just had goosebumps when you were saying that, one of your old mentors reached out to you saying that she'd been thinking about it for so long, because most people really will choose being in an uncomfortable place over uncertainty and taking a leap that they don't know where they're going to end up. So I'm sure that was just an amazing sign from your end of being like, okay, I'm doing the right thing. I have people supporting me. And I feel like, especially in the entrepreneur community, it's not uncommon to have that kind of support.
Oh yeah.
And it's great that you were able to get that immediate gratification almost from someone that you respect. And that's an amazing way to start.
Yeah, I remember, like, I tease, but she was just like one of those people that her intelligence was like so intimidating. So yeah, it was humbling to say the least. And then just like a couple of days ago, I was on the call with another past pharmacist I work with again, who, like, because I came from just 1 year residency, and these girls were no BS. Like, if you're going to touch a patient, you better know what you're talking about. And so, and I only had one. I was like one of the few, if not the only, that only had 1 year. And so they were hard on me, and it was just weird talking to her the other day. And she's like, "Are you hiring?" Like, who would have thought that, my mentors would be asking one day if I'm hiring? It's humbling, but just another reminder of like just how life works out. And yeah, I mean, there wasn't any certainty. To be 100% honest, my husband would kill me, but I knew I just wanted to do this full time. I quit. And then the next day I told my husband. So it wasn't like, because I knew like I had to do this, and he was always going to tell me, like, he's so supportive, but he's not a risk taker. So I knew he was going to keep telling me, like, just keep doing the weekends. Just like keep doing the weekends. It's like an extra $600, but he wasn't appreciating how much that was taking away from my business and my passion. And so, yeah, I don't advise wives to do that. I was like, I would rather tell you that I cheated on you. He's like, oh God, this is not going to go.
Let me set the stage here.
I did something worse than cheat on you. I did my job without telling you. And he knows me enough that he was like, all right, well, you're going to figure it out. I'm going to figure it out. Yeah, it was just like, it's just such a hard thing to actually, you're never going to be ready to be like, all right, I'm just doing this. So it was just like, for me, I was like, I just have to do it. Like, I felt like I was like slowly dragging it out. And that was actually causing me a lot of anxiety too. I'm like, no, you have to do, if this is what your heart's set on, just do that.
And there certainly becomes a point when you are developing your business on the side where your job becomes more of a detriment than an asset to your new business. And so the fact that you were feeling that, and you knew I need to make the jump, I need to make the cut. And there's certainly an element of sink or swim to leaving your job.
Yeah.
But there's also a very large element of planning and making sure that you're ready and that you have something up and running so that when you make that transition, it's not as scary.
Yeah. Like, I knew, I'm like, all right, at the minimum, I have these facilities at least for a year, and that will give enough time to like show our work, essentially, was like what I knew. So I started the clock.
That's right. All right. So Jena, I'm going to kind of wind this up with just 3 easy questions that I think will really resonate with the listeners and maybe give them some inspiration to starting something new or maybe pursuing a non-traditional pharmacy career path. So what is the most memorable aspect of being a business owner, and why?
I would say, honestly, like when I was in the hospital, some days it sounds so dramatic. Like, I just didn't look forward to going to work, right? And so I think being a business owner, and like, I wake up every day with like a fire in my belly, like I have control to change patients' lives. And so that's really where, because I'm in the driver's seat, and quite transparently, as I start like looking for different investors and stuff to really build this up, it's just a non-negotiable for me that clinical comes first, and then, we'll figure out a way to get reimbursed and everything secondarily. So I think being able to apply my own values instead of relying on, my bosses, even though my old boss is she's amazing, but, instead of relying on somebody else, I think that was really what like gets me fired up, is like, I can create this, like I can make it so that patients get the best care. And that really, fires me up every day.
It benefits you. It benefits the patients. It keeps you going. It's just wonderful once you felt that. And it's great motivation to continue what you're doing. What is one piece of advice for anyone that's contemplating a non-traditional career path?
I'd say go for it. The worst case, you go back to your traditional job, right? Like that's what I kept telling my husband. Like, I have 12 years of pediatric experience. I can easily find like another job if I need to, or I ended on such great terms. Like my boss said, like, come back whenever you want. So like, worst case scenario, you go back to where you were, right? I mean, I give it a good try. I think you need to at least do it for like a year to see if like you're gaining any traction. But I do think like I'm always like the worst case scenario. Like if we were drowning and I couldn't pay my bills and give my girls what they need, I would just go back to a week. Like I'll go walk into CVS and apply and get a stupid bonus. That might be miserable, but like, you know what I mean? But like that's the worst case scenario is you go back to a traditional job. And we're needed now, so leverage it.
That's right. I mean, COVID has shined a light on the profession in a way that hasn't been shown before. And so it's great that pharmacists are using that to their advantage to finally advocate for the profession. And it's a beautiful time for you to be making this transition and have a company that's so successful in such a short amount of time. It's wonderful.
Oh, thank you. Definitely.
And then last question for you, your favorite part about being a pharmacy entrepreneur?
Advocating on the behalf of our profession. Like I said, I before we started this, I like lived in this like really ignorant bubble of like, oh my God, pharmacists are awesome. Like I worked in hospital settings. I had basically collaborative practices. I felt like even more than a collaborative practice with, especially with like the medical residents and the attendings, because you got to know them so well. And so there was such like a trust factor. And I quickly realized when I tried to make some changes when I first started pre-collaborative practice with a lot of my kiddos, like we couldn't even change concentrations of medications. And I'm like, if we're not equipped to do that, who is? So it's really like, again, I admire what you're doing, getting involved in like the legislative change. That's like after 5 years, after I build this up, like that is the next step for me is getting involved because you know, of course I'm involved in associations and everything, but again, I wasn't active in a single association before entrepreneurism. And now I think I'm like a serial association person. I'm like in like 10 pharmacist associations and then a couple other just like random entrepreneur ones. But it really, again, if I'm in a position where I can advocate for the profession that I didn't know we needed this much advocacy in the outpatient world because just like you, I'd been in hospital the whole time. And I didn't realize that it was an issue.
Well, that's beautiful. And I hope that in a couple years, you know, you're the state of New Jersey pharmacy practice and sitting at the Senate and pushing things forward. That would just be such a full circle moment and benefit everyone in the state. Yeah, that's wonderful. Well, Jena, thank you for taking the time to be here today. This was such a powerful interview. I feel like you were so authentic, so many life lessons, and you're an inspiration to so many. I know just starting this business and making it so successful, going across multiple states with multiple hires. I'm excited to see what Perfecting Peds does in the future. So thanks for being here.
Thank you for having me.
As we conclude this week's podcast, an important reminder that the content on this show is provided to you for informational purposes only and is not intended to provide and should not be relied on for investment or any other advice. Information in the podcast and corresponding materials should not be construed as a solicitation or offer to buy or sell any investment or related financial products. We urge listeners to consult with a financial advisor with respect to any investment. Furthermore, the information contained in our archived newsletters, blog posts, and podcasts is not updated and may not be accurate at the time you listen to it on the podcast. Opinions and analyses expressed herein are solely those of your financial pharmacist unless otherwise noted and constitute judgments as of the dates published. Such information may contain forward-looking statements which are not intended to be guarantees of future events. Actual results could differ materially from those anticipated in the forward-looking statements. For more information, please visit yourfinancialpharmacist.com/disclaimer. Thank you again for your support of the Your Financial Pharmacist podcast. Have a great rest of your week.